Most students have a few more weeks of summer, but many student athletes are already training hard for fall sports. While athletics can be positive for both mental and physical health, overuse injuries among children is on the rise. Dr. Kumar is on call this morning with important information to keep your student athletes safe. This is just so important to all of us moms, especially. What do you mean by overuse injuries?
Right, so typical overuse injuries are your shin splints or tendonitis, Achilles tendonitis. It can really creep up anywhere on the body. And overuse injuries literally come from overusing a certain muscle group, putting that repetitive strain on the same body part. Now, kids are very susceptible because they're still growing. Their muscles, their tendons are not fully developed. The problem with these overuse injuries are not only can they sideline a player, but they can affect their normal growth and development. And right now they represent 50% of all sports-related injuries in the youth population.
Yeah, early specialization, they call it. So why is that so harmful to kids?
Okay, well, early specialization is that intensive competition in one organized sport. They say greater than 8 months a year for children under the age of 12. Essentially, that's when parents limit children to one sport only. Why is this a problem? Well, I mean, parents think they're doing the right thing, but not only does it lead to these overuse injuries, but there's also emotional stress. There's a high rates of burnout, high rates of anxiety, and you know, a lot of people are doing it because they're thinking about the collegiate scholarship or professional fame, but that's statistically pretty low. The attrition rate for kids in organized sports is 70% by the age of 14, and that's because kids just really want to play.
What puts kids at the greatest risk for overuse injuries?
Overtraining. Kids are overtraining these days. Really, experts recommend 10 consecutive weeks off every year from a sport and at least 1 to 2 rest days every week, which a lot of people aren't doing. Also, we're seeing kids that are playing on 2 or more teams on the same season, same sport. So they could be playing on 2 or 3 soccer teams at the same time. And then finally, a lot of kids are being encouraged to play through pain. I see parents on the sideline doing it all the time. Youth athletes should not be in pain. Good rule of thumb, parents.
Yeah, so let's talk about what parents can do to prevent any of this from happening.
Okay, so rest is paramount. I mean, give your kids prolonged periods of time off. And during that time off, that doesn't mean that you're sitting and playing video games. Play a different sport, or guess what? Go outside and play, like climb a tree. How about
exactly.
that?
Let's try something. Yeah, exactly.
Trees? That's what they're there for. And then strength training can also be helpful. And another thing that's very important, keep an eye on your child's vitamin D level. Vitamin D deficient kids have a 4-fold greater chance of having a serious sports-related injury.
Wow, this is such good advice for parents. Thank you so much, Dr. Kumar, for being here.